joined now by Catherine Hine and Paige Robson from Financing for Development to tell you a little bit more about the Pledge Guarantee for Health, which actually came out of an idea that started in the System Strengthening Working Group several years ago and has grown into its own nonprofit just about. So, but we're very excited to maintain a close relationship with the Pledge Guarantee. And so I'm going to turn it over to Catherine. The format for today is we'll start with a presentation, and then we'll go into Q&A. So we have you all on listening mode only. So please just write down your questions as you go along, and then when we get to the Q&A, I'll give you more further instruction on how we're going to do it. So with that, I'm going to turn it over to Catherine.
Hi, good morning. This is Catherine. So I'm going to talk about the Pledge Guarantee for Health, or PGH, which is a program that was designed to facilitate private-public partnerships in order to address gaps in overseas development assistance and lead to greater efficiency and health outcomes ultimately. Slide 2 has a, just a moment. Again, not able to scroll down on my slide, so hold on just a moment. Slide 2, which I just went to, has a link to a video on PGH, which can provide more details on the program. So when you have a chance and you get the PowerPoint later, I encourage you to take a few minutes to take a look at the video. It'll provide more information on the work that we've done. PGH was developed by the UN Foundation with support from the Gates Foundation to address the issue of timing lags of donor disbursements. So as you know, once a donor makes a pledge to a sovereign or an NGO, it can take up to 12 months or longer for those funds to actually be dispersed. So in the interim period, the grant recipient is waiting and not able to move ahead with procuring the health commodities that's the purpose of the grant, which can often lead to stockouts and other inefficiencies and problems. So, and further, once the grant recipient receives the funds, it then has to often pay for emergency shipment costs, and overall it has low negotiating power with the procurement agent and the healthcare commodity supplier. You'll see on this slide 4, the Brookings Institute actually published a study which showed that up to 28% of all overseas development assistance funds are lost due to this funding volatility. So the PGH program was developed in order to address this problem. PGH basically creates private-public partnerships by facilitating financing for donor pledges. So effectively making donor pledges bankable, grant recipients are able to start the procurement process sooner and at the time the grant is actually pledged, and then start the order and shipment process and the delivery of health commodities much earlier than it would be able to otherwise. Once the donor grant is dispersed, those funds are used to pay back the lender, and then any remainder that's left over in that grant goes back to the grant recipient. PGH was has established partnerships with lenders, including EcoBank and the Calvert Foundation, and PGH's role is to facilitate the financing for the grant recipient, which is the NGO or the sovereign. Does this by issuing a guarantee to the lender on the basis of a donor pledge. So the PGH guarantee effectively makes that grant pledge a bankable commodity. So once the donor disperses the grant funds, those are used to pay back the lender for the loan or the letter of credit that it's issued to the grant recipient. And otherwise, without PGH, donor pledges are generally not enforceable contracts, and the PGH guarantee that it issues provides the assurance to the private sector lender, which would be EcoBank or Calvert or Standard Bank, that it will get repaid. And in cases where the donor actually does not disperse the funds, then the PGH guarantee would cover the lender for the credit that it's extended to the grant recipient. In addition, PGH has negotiated agreements with a number of major pharmaceutical suppliers, including Merck, Vestigard, Pregna, and Bayer, under which suppliers have agreed to provide an 8% upfront discount for all orders which are placed using a PGH bridge financing. So PGH then works with the lenders to get the total cost of financing, including all their fees and interest, to be less than 8% annually. So effectively, the supplier discount offsets the financing costs, and the value of the donor pledge to the grant recipient ends up being the same or greater than without using PGH. So if the donor and the grant recipient are able to work together in order to get the grant dispersed in under 12 months, then the recipient still benefits from the 8% supplier discount, plus the financing costs are less than the 8%, leading to greater value for the grant and ultimately better health outcomes. So in this way, PGH works to help avoid stockouts, gives grant recipients better negotiating power, builds government capacity for aid management, increases health impact for donor funding at no additional cost. In 2013, the UN Foundation spun off PGH, and with support from organizations such as RHSC, USAID, the Swedish Development Agency, and the Packard Foundation, PGH has been a successful program which is now housed within Financing for Development Corp., which is a US 501c3 nonprofit organization. It's been endorsed by the Global Fund and has done a number of transactions for World Bank grants. On this slide, we can see the number of countries that PGH is able to work in. So you'll see that it is a global program, can be used in 126 countries around the globe, and we focus particularly on sub-Saharan Africa, but you will see that its reach is pretty far in Latin America, Asia, and in Africa. On slide 10, we have a pre-approved list of donors on our investment criteria for which PGH can issue bridge financing. So these include the major donors for in the health sector, particularly the World Bank and the Global Fund. But this list isn't exclusive. We can certainly work with additional donors. We just have to get donors which aren't listed here. We have to get approval from USAID for those pledges. But this is a pretty strong list of the major donors for the health sector. So before wrapping up, I just wanted to go over a couple of examples of PGH transactions where PGH was used successfully, and then that should help illustrate the way that the program can be used by grant recipients and donors. In 2011, PGH was approached by the World Bank about a grant that it had made for the government of Zambia for malaria. And the World Bank was concerned because by the time that it had made this grant, the rainy season was approaching and it didn't anticipate actually being able to get the funds dispersed before the rainy season, which would have undermined the purpose of the grant. So PGH was able to get a loan through, or get credit from Standard Bank of Zambia to the government of Zambia, and using those loan funds, the Ministry of Health in Zambia was able to put in an order for 800,000 bed nets and get the order shipped and delivered ahead of the rainy season. So that's a way that that PGH was able to facilitate the financing and the delivery of this, the bed nets and the health commodities. Now, in addition to that, PGH worked closely with the government of Zambia and the World Bank after the order was placed in order to go make sure that the grant that was pledged to Zambia went through the process, the World Bank processes as quickly as possible, and to make sure that all of the deliverables by the government were delivered to the World Bank under the grant in a timely fashion. In the end, the grant from the World Bank was dispersed in 6 weeks, which was a very fast turnaround period for a World Bank grant. And the overall cost of financing, therefore, ended up being less than 1%. So by using the bridge financing through PGH, there's a nice alignment of incentives for both the donor and the grant recipient, because by trying to get those funds dispersed as quickly as possible in order to repay the lender, then they're able to save on the costs, and the donor is able to benefit from the greater value of the funds under the grant. And so both are motivated to get the grants dispersed as quickly as possible in order to repay the lender. So there's a nice carrot there for the donor and for the grant recipient. PGH also works on cases where there's roadblock removal, which doesn't necessarily require financing per se. So for example, in the Ukraine, PGH was able to get Merck to lower the price of hepatitis C medication. And typically, because those hep C drugs are priced so highly, the Global Fund did not authorize the use of their funds for hep C medication, but because PGH was able to work with Merck to get and convince them that it was a market entry move in order to lower the price of their hep C drugs, it was able to get Merck to agree to lower the price of those drugs, and the Global Fund consequently was able to make an exception to authorize the use of its funds to fund hep C drugs. And this enabled an NGO working in Ukraine, Alliance Ukraine, to address the co-infection rates for hep C for its HIV population that it was treating in the Ukraine. So to date, PGH has done over $30 million in transactions, with countless more in assistance and technical assistance and roadblock removal. Should I take any questions that people have?
Okay, thank you very much, Catherine, for this great presentation. So what we're going to do now, so briefly before the Q&A, you're going to see a survey pop up on your screen. That's just for us as a coalition. We're trying to track how people are finding out about our webinars, so we can help us get the word out. So please take a minute to just answer that survey briefly. And then in the meantime, we would like to invite questions from the audience. If you have questions for the PGH panelists, you can select the raise your hand icon next to your name in the menu on the right-hand side of your screen. Once we see you, we can unmute your line so that you can go ahead and ask your question. Or if you prefer, you can type a question under the question window at the bottom of your GoToWebinar dashboard. And we will receive your questions and then read them out for the group and for our presenters to answer. And if you have a poor audio connection, we encourage you to please type your questions this way. So with that, is there anybody who has any questions? So I'm going to, as the moderator, I'm going to take the liberty of asking the first question. So, Catherine, I was wondering if you could tell us, you said that you've mobilized $30 million in transactions. How many transactions is that? And, what are some of the challenges that PGH has encountered when it's, trying to execute a transaction?
That's about 6 transactions. So we've done deals in Zambia, the Philippines, Jordan, Ukraine, which I mentioned, the Philippines. And we, like I mentioned, we also work on cases where people approach us and maybe there isn't financing required per se, but they, you know, it's roadblock removal or technical assistance. So we've done a number of those cases where we will just talk to the NGO or to the grant recipient or to the donor and try to figure out other solutions. In terms of challenges, well, I think that it's always, I mean, I think one of the challenges and what we're trying to address is that what we found is that donors, especially the large donors like the World Bank and the Global Fund, do actually pay out on their pledges once it's made a commitment. So it's, you know, 97+% of pledges are actually paid out. So it's a very secure, it should be a bankable commodity. Like once the recipient receives a pledge, then there is a very, very strong chance that the donor will actually pay out. The challenge is that banks aren't used to that, and you don't have an enforceable contract per se. You don't have a legal document that they can take as a collateral. So I think it's the challenge is trying to get the banks to and their credit committees to recognize that, you know, these donor pledges are actually something that they can extend credit on the basis of. And I think that's what PGH is ultimately, the purpose is to build those relationships, to build those partnerships between the lenders, such as EcoBank and Calvert Foundation, and the grant recipients. And hopefully once you've done a couple of these transactions, then the lender is familiar with this. They have a history of extending credit on the basis of these donor pledges, and they wouldn't necessarily need a PGH guarantee, for example. But I think that is the challenge, is trying to get the lenders familiar with the space.
Hi, and this is Paige Robson. I'm also a PGH. I'm a program coordinator, and I think, Catherine, that's a great example of, you know, challenges that we face in terms of executing our business. I think, you know, just as I was thinking in the background, some of the challenges that we aim to solve, I think there are 3 major categories. Sometimes we hit one of them, sometimes we hit all 3. The first would be timing. So in the example of Zambia with the bed nets, the money was there, but it wasn't going to be there soon enough. So we jumped in to accelerate the funding that addressed a timing issue. Sometimes it's a pricing issue. You know, if they were to, you know, procure later at a lower, you know, value, so they get higher price premiums and they lose value there, or they're, you know, forced to do rush shipping, which is expensive, or rush production, which is expensive. They're losing value there. So sometimes we jump in and we get, you know, a pricing benefit. And then the third kind is strategic. For example, with the Implement Access Initiative, you know, there was a deadline to hit a minimum volume, and, you know, Ethiopia was not able to contribute to reach that, you know, ultimate volume to get the discount without front-loading 2 years' worth of purchasing at once, which they would not have been able to do without aggregating their donor funds through PGH. We ended up taking DFID funds and World Bank funds, putting them together, accelerating that purchase to get within the timeline and to get to the volume deadline so that all the prices came down retroactively. So I think those are 3 of the challenges that we seek to solve.
Great. Thank you, Catherine and Paige. This is Jamie Kuznicki from the Coalition. And I'd like to share a question we got from one of our participants that was typed in. And he asks, what are the key strategies you have to drive accountability and transparency to providers who receive funds from donors?
Well, we do, I'm not quite sure because I'm understanding him as transparency for suppliers.
I think it's transparency with the recipients of the
grant
donor
recipients.
funds. Yeah.
Okay. Well, once we actually issue a PGH guarantee and facilitate the credit, the loan or the letter of credit from the lender, we don't just stop there. Like I mentioned in Zambia, it is in PGH's interest to make sure that donor pledge is paid off or the donor pledge is dispersed and then the bank loan is paid off as quickly as possible, because we want to avoid the situation where we would have to pay out on our guarantee. So we monitor very closely and work very closely with both the donor and the recipient to make sure that all of the bureaucratic hurdles that are in place before the funds can actually be dispersed are crossed as quickly as possible. So we make sure that any documentation or deliverables that the grant recipient has to provide to the donor to make sure that the donor funds are used appropriately are delivered to the donor as quickly as possible. We want to make sure that everything that the donor needs in order to disperse is done. And I think that the donor itself has a lot of those mechanisms in place to make sure that the grant recipient is using its funds appropriately. We also do monitoring and evaluation after transactions to try to quantify, how the donor pledge was used and the impact that it had, how many end users in the population actually benefited from the donor pledge. Because ultimately the goal here is to lead to greater health outcomes and to the delivery of essential health commodities. So we do monitoring and evaluation in order to track how the program has impacted the actual country and the population.
Great, thank you, Catherine. We have a question from Hans Demmer. So Hans, I've unmuted you.
Hi, good afternoon. Hans Demmer, Concept Foundation. It was a great and very clear presentation on the pledge guarantees for health. Thank you so much. I have a question regarding maybe a slightly different pledge or slightly different loan. There might be products that are available in large quantities because companies produce large batches, like 100,000 pieces of something, while countries only need 1,000 a year or 10,000 or 20,000. So a country or a small organization somewhere has no capacity to purchase that large amount. Now, an organization like Concept, for instance, or any other organization can say, we act as kind of a middleman. We go to that company, the manufacturer, and say, we buy the 100,000 whatevers, and we pay for it, and we distribute it at cost to the countries and organizations that need it. That kind of financing up front, because the organization, we for instance, would have to pay up front the 100,000 pieces that are needed, that are purchased. Would PGH be willing also to pre-finance those kind of transactions? And of course, in the course of a few months, everything will be paid back because countries and organizations buy it, but in smaller quantities.
Right. I think we'd definitely be interested in speaking with you. I think if we could identify actual donor pledges that are going to go through or are pledged to the recipients that are buying those commodities from the Concept Foundation, then what we would do is then figure out a way to pre-finance, as you said, a group of donor pledges in order to bridge that timing gap of when they're dispersed. But you will see here there's an email to Erin Betru, and I'll type my email as well. And please, if you could follow up with me, and love to talk to you about that and get more information.
Great, thank you, Catherine. We have another question.
Thank you.
Thanks, Hans. Great, we have another question from John Durgovich. John, if you could ask your question.
Yes, hello. Thank you again for the presentation. It was very interesting, and I'm gratified to see how this one of the hurdles, the financing hurdle, is now being overcome in some places. My question is about closing the loop on the procurement itself and the receipt of the product. One of the barriers that we've had in some countries in the past has been the customs and port clearance leg of the shipments. So I was wondering if you had experienced any issues around being able to close out the procurement transaction, any delays related to that leg, or have there been specific actions taken by your partners to reduce the potential barrier caused by delays in port and customs clearance?
I am not aware that that was an issue in any of our transactions. I mean, I certainly, appreciate what the question is and what you're talking about, but I think, my suspicion would be that at the port and customs clearance, the government would have a large amount of control over that. And so I think that we do work with NGOs, but we often work with sovereign recipients of these donor pledges. So, like I mentioned, the grant recipient, and if it's the sovereign, is certainly motivated to try to pay off the credit that it's received as quickly as possible.
Sure.
And so I think we would work with them to try to use the soft power and the power they have over those customs and shipment receipt.
Yeah, and also just add one thing, Catherine, this is Paige from PGH. Before we enter into any transaction, we do convene an investment committee internally that's it's comprised of representatives from the lender, from the borrower, from PGH, from the supplier, and also from the donor who's providing the funds. Each person is a representative saying, from their point of view, if it's beneficial from a financial point of view, from a health point of view, and all of these people, after being in this and seeing, what it is possible, to increase their impact, are pretty highly motivated and pretty good champions on behalf of moving things along where they need to be moved along. I can say that, in all of our past transactions, as Catherine said, it hasn't been a problem, partially because of relationships that we build with those stakeholders and also with the government and country.
Yeah, that's a very good point. We also have, we have our own guarantee from USAID, and we have our guarantee from the Swedish Development Agency. We have the relationship with the donors, so we have quite a bit of soft power that that we rely upon in order to facilitate the flow of funds.
Okay, does anyone else have any questions? I'm not sure we see any more hands raised.
Well,
all right.
I can type my email here, and hopefully everyone can see it. It's CHEIN@pledgeguarantee.org. And if you have any questions or anything else that you think about after this presentation, please do contact me. You can also contact our managing director, whose email is on this slide, and info@pledgeguarantee.org.
Thank you very much for that, Catherine. So again, we really appreciate everyone coming on and joining us for this webinar and for your active participation. Thanks again to Catherine and Paige for helping put this together. So enjoy the rest of your day. Thanks a lot, everyone.